Why should you monitor potassium levels? The main job of the kidneys is to clean your blood of excess fluids and waste products. During normal activities, these powerful fists can filter 120 to 150 liters of blood and produce 1 to 2 liters of urine per day. This helps prevent waste from accumulating in the body. It also helps keep electrolytes like sodium, phosphate, and potassium at healthy levels. The renal function of patients with kidney disease is impaired. They are often unable to effectively regulate potassium. This can lead to dangerous blood potassium levels. Some medications used to treat kidney disease also increase potassium, which can make the problem worse. High potassium levels usually develop slowly over several weeks or months. This can cause fatigue or nausea. If potassium levels are suddenly elevated, you may experience shortness of breath, chest pain, or heart palpitations. If you start experiencing these symptoms, call your local emergency service. This condition is called hyperkalemia and requires immediate medical attention. How can I minimize my potassium buildup? One of the best ways to reduce potassium buildup is to make dietary changes. To do that, you'll need to learn which foods are high in potassium and which are low. Be sure to do your research and read the nutritional labels on your food. Keep in mind that it isn't just what you eat that counts, but also how much you eat. Portion control is important to the success of any kidney-friendly diet. Even a food that's considered low in potassium can spike your levels if you eat too much of it. Foods to add to your diet which are considered low in potassium if they contain 200 mg, mg, or less per serving. Some low potassium foods include berries, apples, grapefruit, pineapple, cranberries and cranberry juice, cauliflower, broccoli, eggplant, green beans, white rice, white pasta, white bread, egg whites, canned tuna and water. Foods to limit or avoid if they contain over 200 mg per serving. You should limit high potassium foods such as bananas, avocados, raisins, prunes and prune juice, oranges and orange juice, tomatoes, tomato juice, and tomato sauce, lentils, spinach, Brussels sprouts, split peas, potatoes, regular and sweet, pumpkin, dried apricots, milk, brand products, low-sodium cheese, nuts, beef, chicken. Although reducing intake of potassium-rich foods is important for those on potassium-restricted diets, keeping total potassium intake under the limit set by your healthcare provider, which is typically 2,000 mg of potassium per day or less, is most important. Depending on your kidney function, you may be able to include small amounts of foods higher in potassium in your diet. Consult your healthcare provider if you have questions about your potassium restriction. How to leach potassium from fruits and vegetables. If you can, swap canned fruits and vegetables for their fresh or frozen counterparts. The potassium in canned goods leaches into the water or juice in the can. If you use this juice in your meal or drink it, it can cause a spike in your potassium levels. The juice usually has a high salt content, which will cause the body to hold on to water. This can lead to complications with your kidneys. This is also true of meat juice, so be sure to avoid this, too. If you only have canned goods on hand, be sure to drain the juice and discard it. You should also rinse the canned food with water. This can reduce the amount of potassium you consume. If you're cooking a dish that calls for a high potassium vegetable and you don't wish to substitute, you can actually pull some of the potassium from the veggie. The National Kidney Foundation advises the following approach to leaching potatoes: sweet potatoes, carrots, beets, winter squash, and rutabagas. Peel the vegetable and place it in cold water so that it won't darken. Slice the vegetable into 1/8 inch thick parts. Rinse it in warm water for a few seconds. Soak the pieces for a minimum of 2 hours in warm water. Use 10 times the amount of water to the amount of vegetables. If you soak the vegetable for longer, be sure to change the water every 4 hours. Rinse the vegetable under warm water again for a few seconds. Cook the vegetable with 5 times the amount of water to the amount of vegetable. How much potassium is safe? It's recommended that healthy men and women over the age of 19 consume at least 3,400 mg and 2,600 mg of potassium per day, respectively. However, people with kidney disease who are on potassium-restricted diets usually need to keep their potassium intake below 2,000 mg per day. If you have kidney disease, you should have your potassium checked by your doctor. They'll do this with a simple blood test. The blood test will determine your monthly level of potassium millimoles per liter of blood, mol/L. The three levels are: safe zone, 3.5 to 5.0 millimoles/L, caution zone, 5.1 to 6.0 millimoles/L, danger zone, 6.0 millimoles/L or higher. Your doctor can work with you to determine how much potassium you should ingest daily, while also maintaining the highest level of nutrition possible. They'll also monitor your levels to ensure that you're staying within a safe range. People with high potassium levels do not always have symptoms, so being monitored is important if you do have symptoms. They may include fatigue, weakness, numbness or tingling, nausea, vomiting, chest pain, irregular pulse, erratic or low heartbeat. This is all about information that we would like to share with you today. If you have any questions or suggestions for the channel, please leave a comment below. Don't forget to click subscribe button and turn on the bell button to receive notifications every time we have a new video. Thanks and see you in the next videos.